Triggering. Triggering refers to the time point when inspiration starts. Cycling refers to the time point when inspiration ends. So, Ti is the duration from a triggering point to the following cycling point. Te is the duration from a cycling point to the following triggering point. BCT is the duration from a triggering point to the next triggering point. Triggering can be realized with different mechanisms. The common ones are time triggering, pressure triggering, flow triggering. Both pressure and flow triggering are regarded as patient triggering. Time triggering is also known as machine triggering or ventilator triggering, and is based on BCT, which is defined with a set rate. Once the rate is set, the ventilator automatically converts the rate to BCT with a simple equation. Breath cycle time in second equals 60 divided by the set rate in breaths per minute. In other words, every set rate has a corresponding BCT. For instance, if you set the rate to 10 breaths per minute, the resultant BCT is 6 seconds. If you set the rate to 20 breaths per minute, the resultant BCT is 3 seconds. The scale shows the commonly used rates and the corresponding BCTs. A BCT is the interval between any two consecutive triggering points. Whenever the defined BCT is over, the ventilator delivers inspiratory gas. Currently, all ventilation modes in Hamilton medical ventilators allow the patient to trigger unless patient trigger is deliberately disabled. If so, an active patient can dominate the actual rate, which is often higher than the set rate. If the patient is passive, however, the actual rate and the set rate are equal. Therefore, the set rate usually serves as the minimum or backup rate. Pressure triggering. Pressure triggering is a form of patient triggering. It relies on circuit or airway pressure monitoring. One way to understand pressure triggering may be that you suck an empty wine bottle. Your effort generates a negative pressure inside the bottle but little gas flow. The stronger you suck, the more negative the pressure is. If pressure trigger is activated, the breathing circuit serves as the wine bottle. The patient's inspiratory efforts cause the airway pressure to drop from the current baseline. If the pressure drop reaches a set virtual threshold, the ventilator is triggered and starts delivery of inspiratory gas. To utilize pressure triggering, you must activate pressure triggering and set pressure trigger sensitivity. The sensitivity is a negative value in centimeters of water, such as -0.5, -2 or -5 centimeters of water. The value represents a virtual pressure threshold below the current PEEP. For instance, if the set PEEP is 5 centimeters of water, and the trigger sensitivity is set at -2 centimeters of water, the ventilator is triggered if the actual airway pressure drops to or below 3 centimeters of water. The smaller the absolute value of the sensitivity, the more sensitive the triggering, and vice versa. So, pressure trigger of -0.5 centimeters of water is more sensitive than that of -2.0 centimeters of water. Flow triggering. Flow triggering is another form of patient triggering. It relies on circuit or airway flow monitoring. To make understanding easier, let us first specify 3 flow types. Flow A, the gas flow measured at the inspiratory limb of the circuit. Flow B, the gas flow measured at the expiratory limb of the circuit. Airway flow, the gas flow measured at the airway. It can be either inspiratory or expiratory. Further, let us divide expiratory time into early expiration and later expiration. Early expiration. At early expiration, the ventilator closes its inspiratory valve, and fully opens its expiratory valve for a maximum expiratory flow. The high circuit pressure drives the gas out, and the airway pressure drops sharply. Both the flow B and the expiratory airway flow rise quickly to maximum and then decrease gradually as the circuit pressure drops. Late expiration. At late expiration, the ventilator tries to rebuild and maintain the set baseline pressure by A, reducing the expiratory valve opening for a high resistance against the expiratory flow, and B, opening slightly the inspiratory valve for a constant base flow, which is crucial for flow triggering. If the patient does not inhale, both the flow A and flow B are equal to the base flow, and the airway flow is zero. If the patient inhales, a part of the base flow goes to the patient, resulting in an inspiratory airway flow and a decreased flow B. If the detected inspiratory airway flow or the difference between flow A and B reaches a defined threshold, the ventilator is triggered. To use flow triggering, you must activate flow triggering and then set flow trigger sensitivity. The sensitivity is expressed in liters per minute, such as 0.5, 1, 2 or 5 liters per minute. The smaller the set value, the more sensitive the flow trigger is, and vice versa. For a ventilated patient, flow trigger is generally easier than pressure trigger under the same conditions of use. Abnormal patient triggering. Unlike time triggering, the patient triggering, both pressure and flow, can fail in two forms. The first form is that a ventilated patient has inspiratory effort, but the ventilator does not respond. The common causes are either the patient's effort is too weak, or the patient triggering setting is not enough sensitive, or both. The second form is auto-triggering, which means that the ventilator is triggered when the patient does not inhale. Typically, auto-triggering appears as a series of quick and rhythmic mechanical breaths. Auto-triggering occurs when the ventilator is triggered by pneumatic artifacts, but not by the expected patient's inspiratory effort. The artifacts often result from gas leak, condensed water in the circuit, or even cardiac oscillation. Another possible cause of auto-triggering is that pressure or flow trigger is set to an overly sensitive level. The best remedy for auto-triggering is to remove the root cause. If this is not possible, you may carefully decrease the patient trigger sensitivity until auto-triggering disappears. Bear in mind that this makes triggering harder for the patient.